everybody, I'm Philip Johnson, patient coordinator at Sponaugle Wellness, and we're here with a young lady that has a wonderful story. This is what we call the exit week, when a patient has been here and treated and they're getting ready to go home. And this is one of the fun and exciting things we get to do, and we hear a story of recovery. So tell us your first name.
Teresa.
Teresa, and where are you from?
Pennsylvania.
And I know it's against etiquette, but how old are you?
59.
59.
Proud of it.
Proud of it? I love it. So let's go back and talk about, you got sick at some point. How long ago? What were the symptoms?
August 15th, 2012.
Okay.
And got sick with what I thought was an upper respiratory condition.
Okay.
And was being treated for that. And it didn't work out. I got worse and worse and worse. Symptoms multiplied.
When you're saying sickness, you know what that means, but I don't. What kind of sickness were you talking about? You said respiratory.
Respiratory.
So, and that should, for those that are watching this is important. Because that will lead into, here in a moment, part of the diagnosis of what we discovered was causing some of that respiratory issue. But tell us what these sicknesses were.
Well, the respiratory cleared up, but then I had horrible neck and shoulder issues that I was dealing with. Terrible. And went to get that checked out, went to my chiropractor numerous times, went for MRI, went for brain MRI, scans, everything, because I thought I had another ruptured or herniated disc, because I did have a ruptured disc before.
Okay.
And everything was clear.
Okay.
Everything was clear on all my scans. Ended up in the hospital because my condition was deteriorating. I was losing weight, couldn't sleep, terrible insomnia. Hospital, they told me I was fine.
Okay.
And that I was depressed.
Okay.
I insisted I wasn't depressed. I was sick. Went on to some more doctors. And just getting very discouraged. Tried antibiotics. Couldn't handle the antibiotics. Made me sicker than what I was feeling. Sure. Then went on to some naturopaths, which did, they tried to help in every way possible. I had numerous Lyme tests done, local ones, which came back negative.
Okay.
So everyone insisted, no, I did not have Lyme. But yet all of my symptoms, a lot of them were presenting as having Lyme. Finally, I went to another doctor. I've seen so many doctors. Went to another doctor whose office did this specialized Lyme test, the Igenix. And that came back positive for Lyme, positive for the co-infections. And so we started treatment again on antibiotics, and for Lyme, antibiotics for the co-infections. Okay. I couldn't handle it.
Yes.
I was sicker. My body just could not handle it. So went back on all the naturopath stuff. Nothing was working. And I was getting sicker by the day, where I was non-functional. And I had lost so much weight I couldn't eat. My stomach was a wreck. And just did not know where to turn at this point. Within about 3 weeks, I think, of phoning down here, I was here.
Yeah.
I was here. And I came in
very sick,
non-functional, very sick, unable to eat, depressed, insomnia. After the second week, I started to notice a difference.
Yeah.
I started to notice a difference, and I thought, wow, maybe something's happening here. And truly, after the first month, I could see the turnaround. I could see things starting to turn, and it was just amazing. I never thought it could. I never thought it could be me.
Yeah.
Never thought it could be me. At the same time, thanking God every minute for leading me here. Here I am now, day before I'm leaving, and I'm well on the way to recovery and starting life. I'm social. I'm talking. I'm eating. I have so much hope.
Yes.
Everyone sees the change in me.
You know who's going to be the happiest man on earth tomorrow?
Oh yeah, my husband's getting in tonight. And my sons have been warning him, Dad.
She's a wildcat.
Mom's normal. Mom's normal. And he is so nervous. He is so nervous.
I can't help but laugh about this.
He says, I don't know what to expect. He says, but they're telling me it's going to be great. And it's just going to be awesome. It's just going to be awesome.
When I first saw you, you and your husband came in, and you were a very sick woman. No color, no life. We cried.
Desperate.
Cried. You were a desperate woman. And
desperate.
I remember your husband and I and you, we prayed together. It was the right thing to do, because we know we needed God to get involved.
Oh yeah, I mean still, every day, there is just no... God has been so good, and there's been so many people praying for me.
Yes.
And wow, it's been awesome.
It has. And then I saw you, as you said, I saw you begin to change.
Yes, people saw it before I did.
Yeah, and you started just walking up and down those hallways with such life, and your color, and animated. And
when I started using my hands again, when talking, that's what really started. Like, oh my gosh, I'm using my hands again because I'm so expressive with my hands. I haven't done that in months. Months.
You said some things in the beginning, and if I can go back and remember some of those things, of course you spoke about all the pain that you were having initially in your neck and your back and
your ears
and a lot of what we see happen here is, you know, the Lyme, the mold, you know, these things are going to attack such things as your myelin sheath, and they become inflamed. This is where a lot of this discomfort comes from, and the inflammation, and you're not only from antibiotic use, inflammation in the gut, but the enzymes from these bugs, the co-infections. We didn't talk about that. Bartonella, Babesia, Protozoa rheumatica, all of these things. We did our proprietary testing on you, and so when you came in that first day, you know, your nurse doctor were able to open up that chart.
I was shocked.
It was shocking to see. And
shocked.
We look at nearly
what did they say? Shock and awe?
Shock and awe.
Yeah,
it is shock and awe when you say, it's, in one sense it's shock and awe, in the other sense it's like, wow, somebody finally...
Yes, I'm not depressed.
Yeah.
I'm not just depressed. I knew I wasn't just depressed.
But you mentioned some depression, and
well, that's just from going through the
Well, yeah, you go through it, but on the other hand, we also discovered mold, that you had high levels of mold.
High. Yes.
And you also had, your hormones were in the tank.
Nothing.
Non-existent.
Yes.
So these things are very, very, they will cause they cause anxiety, they cause depression. You know, these things will create these kind of issues in our life. Mold will knock your hormones down to nothing. So there was medical reasons why you were feeling, you know, the way that you were feeling.
And no one was able to address those issues.
No one would have understood. We are a very special place here, and when I tell somebody, well, we have some proprietary testing, and there's a really big blood panel.
Oh, there sure is.
And I tell them kind of, you know, how much blood's going to be drawn. But when they see what we produce from that, when we see the numbers, as Dr. Rick Sponaugle has investigated, has treated thousands of patients, and they have learned, he's learned what's been compromised, how Lyme disease, mold, the co-infections, Bartonella, and so on and so forth, Protozoa rheumatica, which is kind of the new kid on the block when it comes to parasites. They understand how this compromises so many things in the body. This is why we diagnose the brain chemistry, and we look at all of that, and hormones, and thyroid, and all of these things have to come into play to get you well again.
Just being able to speak to someone who knows that they're not crazy.
Yeah. Yeah, it is. It's a relief to say, wow, somebody knows what I'm talking about. Finally, somebody understands.
And I've seen the same process with other people here who I look at them and I say, wow, you are changing.
Yeah.
And they say, yes, I am. And it's just awesome, and you're just in tears,
yeah.
and you grab their hand and you hug them, and it is just such joy.
I know. I've become a crybaby around
It is
here.
just such joy.
Mold was a big issue with you. And we go over this all the time with our patients because it's so misunderstood, it's undiagnosed, it goes untreated, and people don't understand how mold can compromise the health the way that it does. And so we tell people, well, we're going to treat you for the mold here. We discover it, we look at real numbers, we treat it. We're going to show you, we're going to do retesting to show you we're getting the mold out, you're improving as you go along. And then, of course, we talk to you about where are you getting this mold? Is it your house that you're living in, the place you work? You can't just go back into a moldy environment.
Everything has to be addressed,
yeah.
Yes.
So you came in so sick, and
it's hard to believe when I think back. It's been 9 weeks.
Wow.
It's hard to believe that. Gosh,
it is.
I was so sick. I never want to go back to that place again, ever, ever.
Oh, I know what that's like. Your symptoms now. You're leaving here. All the symptoms you came in with. Let's help these folks that are watching this understand. Maybe we can use a number, a percentage, to try to say, am I 10% better than when I got here, or am I 100% better? Are all the symptoms gone? How would you try to explain the way you feel right now? Because you're just animated.
Yeah, I would say I'm probably 75% better. Maybe a little bit more. I don't know. I'm just always just trying to compromise.
A
little conservative. But I know I have a little ways to go yet, because I never stopped from all day. I never sat down. I was just going constantly.
Okay.
I ran the show, and
all right.
And I know I'm not up to that at this point. I'm still going. I don't have to go lay down during the day. I go along. I do whatever I have to do.
The reason you can go home right now, even let's say at 80%, is because we've tuned your body up. We've optimized every cell. We've improved your immune system. We got your hormones back where they need to be. We balanced brain chemistry, and so it's able to function correctly and turn on the right switches. And so your body is back in the place where God intended it to be, to continue the healing process, even now back in the comfort of your own home.
I can't wait to start my life again. I
It'd be
didn't,
a wonderful thing.
because I had no life upon coming here. I had nothing, really. It has been such a blessing. It has been such a blessing. I'm so happy that we decided to come here, and it was a big step in every way, but it was the best thing. It was the best thing, not only for myself, but for my whole family. Everyone is just thrilled.
Wonderful.
Everyone is just thrilled.
I failed to mention it, I believe. Did we mention that where you're from, what state you're from?
Pennsylvania.
And so, you're not around the corner. It was
No.
a big step.
Yeah, very, very big step. But it's all been well worth it. Well worth it.
Wonderful.
It was the best decision. It was the best decision. It was the only decision. It was the only decision.
It's been a pleasure.
There is hope. There
is hope.
There is hope.
There is. We see it. We see miracle stories here all the time. And so, to everybody watching this, thank you for taking the time to visit with Teresa and hearing her very exciting story of recovery. And we can answer any questions for you and tell you about our treatment protocol. Please call Sponaugle Wellness, and we'll do our best to welcome you here and make you the next picture of good health. Thank you very much.